Hey everyone, and welcome to a deep dive on something you literally can't live without.
Or more specific.
So your respiratory system.
Yeah.
Buckle up because we're about to go way beyond breathing 101.
Yeah.
We've got nursing school lecture slides, even a test. And this stuff gets surprisingly wild. I'm telling you.
It is wild.
All right, so to kind of set the stage for our deep dive today,
Yeah.
we are going to be looking at the respiratory system as a whole, but with a special focus on
Oh, yeah.
infections and conditions that can really impact your breathing.
Mm.
So listeners, get ready for some fascinating insights and some really practical knowledge.
Absolutely. And, the respiratory system, it really is constantly battling that outside world, filtering air we breathe, fighting off invaders. And it's something we often take for granted.
Yeah, absolutely. We don't even think about it.
Right.
So that's what we're going to do today. I don't know if you've ever heard of something called walking pneumonia, but you might have had it and not even realized it.
It's true.
And then another thing that I found really fascinating was that tuberculosis is actually a leading cause of death worldwide.
Yeah, it's crazy to think about.
Yeah, it's not a thing of the past.
Not at all.
And, they were saying in some areas it's actually on the rise.
It is. Yeah, it's a major global health concern for sure.
It is. So this really highlights that respiratory health is a global issue.
Absolutely.
So let's jump right in.
Okay, let's do it.
So first up, pneumonia.
Yes.
So it's way more than just a bad cough.
It is.
It's an acute inflammation of the lung parenchyma.
Yeah. And imagine your alveoli, those tiny little air sacs in your lungs, they're filling up with fluid. They're fighting off all these invaders, whether it's bacteria, viruses, or even fungi.
Whoa.
It's like a microscopic battleground happening inside you.
Well, that's way more intense than I pictured.
Yeah.
It's like a war zone
Right.
in your lungs.
Uh-huh.
Okay, so we've got pneumonia as a general.
Yeah. Mm-hmm.
But there are different types of pneumonia.
Yes. So the materials break it down into several different categories.
Yeah.
But the most common type you'll see out there is community-acquired pneumonia, or CAP.
Okay.
And so you can think about this as catching pneumonia out in the world.
Yeah.
Not in a hospital setting or anything like that.
Got it.
And the usual suspect here is a bacteria called Streptococcus pneumonia.
Oh, I've heard of that one.
Yeah.
Okay, so that's out in the community.
Mm-hmm.
But what about the pneumonia you get after you've been admitted to a hospital?
Oh, that's a whole different beast.
Is it?
Yeah, that's called hospital-acquired pneumonia, or HAP.
Okay.
And it's often more serious because the bacteria involved are often drug-resistant.
Oh.
Which makes treatment a real challenge.
So that's why they have all those really strict infection control protocols.
Absolutely. Those protocols are there for a reason.
Yeah, that makes a lot of sense.
Mm-hmm.
Okay, so we've got community-acquired pneumonia, hospital-acquired pneumonia.
Right.
What other kinds are there?
Well, there's this other one called aspiration pneumonia, and it occurs when something other than air enters the lungs.
Oh, no.
Yeah, so think food liquid or even vomit.
That is unpleasant.
Yeah, not a pretty picture.
No, not at all.
And this one's more common if you have any kind of trouble swallowing.
Okay.
So that's something to keep in mind.
Okay, so aspiration pneumonia. What if your immune system is compromised?
Oh, yeah, good point. So in individuals with compromised immune systems, maybe they have HIV or cancer or other conditions that weaken their defenses, they can develop something called opportunistic pneumonia.
Opportunistic pneumonia.
Yeah, it's kind of like it's waiting for the opportunity to strike.
Wow, so there are a lot of ways
that
pneumonia can kind of sneak up on you.
Absolutely.
So what's actually happening inside the lungs when you get pneumonia? What does that look like?
Okay, so the lecture notes actually describe this fascinating 4-stage process.
Okay.
And it all starts with congestion. So those tiny air sacs, the alveoli, they start filling up with fluid. Yeah, and that's when they're battling the invaders, right?
Huh.
And then next comes red hepatization.
Red hepatization?
Yeah.
What is that?
It's where things get really interesting.
Okay.
Because the lungs actually change color.
Really?
And texture, they become red and firm, almost like a liver.
The lungs can change color.
They can. It's pretty wild.
That is wild.
Yeah, and then it moves on to gray hepatization, where the red blood cells start breaking down.
Okay.
And finally, we get to resolution, which is the healing phase.
Okay, so the body really goes through a whole dramatic transformation.
It does.
Fighting off pneumonia.
It's quite a process.
But before it gets to that healing stage, you're probably feeling pretty awful.
Oh, yeah, definitely. You're going to be experiencing those classic symptoms, cough, fever, chills, shortness of breath, chest pain, the whole works. Yeah. And then there's atypical pneumonia, which can be a little sneakier.
Oh, really?
Yeah. It might just present with those milder flu-like symptoms.
So it's not always so obvious.
Right. It can be tricky.
And then, aside from just feeling yucky, are there more serious complications that can happen?
Oh, there can be, for sure. You might develop pleurisy, which is inflammation of that lining of the lungs.
Okay.
Or even more seriously, things can progress to sepsis or respiratory failure.
Okay, so that's where the nurses come in.
Absolutely. Nurses play a critical role in all of this. So a skilled nurse will be, carefully monitoring vital signs, listening to those lung sounds, checking those oxygen levels. And it really is like detective work, figuring out what type of pneumonia are we dealing with, and then providing that supportive care to get the patient through it.
Yeah.
And treatment will depend on, the type and severity of pneumonia, but we're talking antibiotics, oxygen therapy, and good old-fashioned rest.
Yeah, you need that rest to heal.
You do.
Okay, so we've explored the world of pneumonia.
Right.
What about tuberculosis?
TB.
Yeah.
It doesn't exactly make headlines every day, but these sources make it clear it's still a major player on the global health stage.
Yeah, it really is.
Yeah. It's caused by this bacteria called Mycobacterium tuberculosis.
Okay.
And it's a tough one. It's really resilient.
Wow.
Yeah. It primarily targets the lungs.
Okay.
But it can spread to other organs.
Oh.
So it's a real threat.
Oh, wow. So it's not just like a respiratory.
Right. It can go beyond the lungs.
Yeah. So in the notes, they talk about latent and active TB.
Yes, that's an important distinction.
Can you explain that for our listeners?
Okay, so picture latent TB like a sleeping dragon.
Oh yeah.
So the bacteria is there lurking in the body, but it's inactive, so you wouldn't feel sick, you wouldn't be contagious.
Okay.
But active TB, that's the dragon awakened.
Okay.
It's causing symptoms, and you are contagious.
Okay.
So you could be walking around with latent TB and have no clue.
That's kind of scary.
It is a little unsettling.
Yeah.
And that's why screening is so important.
Okay.
So we use a tuberculin skin test, also known as the Mantoux test, and it can check for TB infection. And if that test comes back positive, then we need further tests to figure out if it's active or latent.
Got it.
And the symptoms of active TB are nothing to sneeze at.
Okay, I'm listening.
We're talking persistent cough, often with blood, chest pain, weakness, weight loss, fever, night sweats.
Oh, wow.
It can really take its toll.
It sounds rough.
It is.
So you've got these symptoms.
Yeah.
How do you treat active TB?
So the treatment, it's a long haul.
Okay.
We're talking a long course of antibiotics, often multiple drugs taken for several months.
Wow, several months.
Yeah, to really eradicate those stubborn bacteria.
Wow, okay.
Yeah.
So public health initiatives for controlling TB, those are really important.
Oh, it's essential.
Yeah.
Yeah.
And the other thing they said about tuberculosis is that it's a reportable disease.
That's right. Public health officials need to track those cases to prevent outbreaks.
Yeah.
And, especially in healthcare settings, those infection control measures, they're absolutely paramount. So we're talking airborne precautions, special masks, meticulous patient education. It's all about preventing the spread of this really tenacious bacteria.
Wow, so much goes into it.
It does. It's a serious condition.
Yeah. Okay. So we've tackled pneumonia. We've tackled TB.
Right.
Now what?
Okay, so let's explore something called pleural effusion.
Pleural effusion.
Yeah.
Yeah.
So imagine your lungs are being squeezed by excess fluid.
Oh, no.
Yeah, that fluid is building up in the pleural space,
Which is?
the area between the lungs and the chest wall.
Okay.
Not a comfortable thought.
Yeah, that image is definitely going to stick with me.
It's a good one to remember.
So pleural effusion, is that fluid building up?
Yeah.
Are there different types of pleural effusion?
There are. So we've got transudative and exudative effusions.
Okay.
Transudative effusions are often linked to some kind of systemic problem, like maybe heart failure or kidney problems.
Okay.
Exudative effusions usually caused by inflammation or infection within the pleural space itself.
Okay. And then the notes mention this other type called empyema.
Oh, yeah. Empyema. That's a nasty one.
Is it?
Yeah, it's essentially a collection of pus in
Yeah.
the pleural space.
Okay.
And it's usually caused by an infection.
Yeah.
It's a serious condition.
So what are some of the signs and symptoms?
So shortness of breath is a common one.
Okay.
Mhm.
It makes sense if there's fluid compressing your lungs.
Right. You might also see chest pain and a feeling of pressure in the chest, and you might hear decreased breath sounds on the affected side.
Okay.
Yeah.
So if somebody has pleural effusion,
Mm-hmm.
how do you treat it?
Well, first we got to figure out what's causing it.
Okay.
So if it's related to heart failure, for example, we need to get that heart failure under control.
Mm-hmm.
Sometimes the effusion will resolve on its own, once we treat the underlying cause.
Oh, okay.
But in other cases, we actually need to drain the fluid.
Drain the fluid.
Yeah, to give the lungs some relief and let them re-expand.
And so that's where those pleural drains and chest tubes come in.
Exactly. They're lifesavers for these patients.
And it's not just like a simple procedure.
No, it's a lot more involved than people might think.
Okay.
And choosing the right type of drain really depends on the amount and type of fluid we need to remove.
Okay.
So for simpler effusions, we might use a small bore drain, sometimes called a pigtail catheter.
Okay.
But for larger volumes of fluid or air, especially in trauma cases, we need those large bore chest tubes.
Okay, so different tools for different situations.
Exactly.
And those chest tubes and pleural drains, they require some really specific nursing care.
Absolutely. It's not just about sticking the drain in there and calling it a day.
Okay, what else is involved?
We need to make sure that drain is working properly.
Okay.
Monitoring the drainage, maintaining patency, managing pain, and preventing complications.
Okay, so there's a whole art to it.
There is.
Now, we can't talk about respiratory conditions without talking about a couple of familiar foes.
Uh-oh.
Influenza and SARS-CoV-2.
Oh, yeah, those guys.
They've really made their presence known lately.
They have, haven't they? They've been keeping us busy.
They have. So, you know those viruses, they can cause anything
Yeah.
from like a mild flu
Yeah.
to like some really serious stuff.
Exactly. Some people get off easy with just a little sniffle.
Yeah.
But for others, especially those who are high risk, we're talking pneumonia, respiratory failure, even death.
Wow.
It's serious stuff.
Yeah. So these sources, they really emphasize prevention.
Oh, absolutely. Prevention is key.
Yeah.
Vaccination, hand hygiene, respiratory etiquette, all those things play a role in protecting ourselves and others.
Absolutely.
And if you do get sick,
Yeah.
treatment focuses on relieving those symptoms. And, in those severe cases, we might use antiviral medications.
Yep.
But as we've seen with these viruses, prevention truly is the best medicine.
Yeah. Okay. So we've covered pneumonia, we've covered tuberculosis, pleural effusions, all these, viruses going around.
Mm-hmm.
There's one more critical concept we have to talk about.
What's that?
ABGs.
Ah, yes, ABGs.
Or arterial blood gases.
Right.
Sounds a little intimidating.
It can sound that way.
But they are incredibly valuable tools for really understanding what's happening inside the body.
They are. It's like getting a sneak peek into the inner workings.
Yeah, and ABGs give us this window into the body's acid-base balance.
Exactly, which is absolutely crucial for overall health.
Okay, so we're going to decode the mysteries of ABGs.
We are.
Coming up.
Stay tuned.
Welcome back to our respiratory deep dive.
Yeah, we've covered a lot of ground already.
We have.
But we're not done yet.
No, we're not.
There's so much more to explore.
Okay, so we've talked about all these conditions.
Mm-hmm.
Pneumonia, tuberculosis,
Right.
pleural effusions.
Yeah.
But now I want to get to the practical stuff.
Okay, I like it.
Like, how does this knowledge translate to
Yeah.
real-world patient care?
That's a great point. Understanding these conditions in theory is one thing, but knowing how to actually assess and care for patients, that's where the rubber meets the road.
Yeah, that's where it really matters.
Absolutely.
Okay, so let's put ourselves in the shoes of a nurse who is facing a patient that they think might have pneumonia.
Okay.
Where do we even begin?
Well, those lecture notes, they really hammered home the importance of a thorough respiratory assessment.
Oh, yeah.
It's like being a detective, you're searching for clues to solve the mystery of what's going on with this patient.
I love that analogy.
It's a good one.
Yeah. Okay, so we're detectives.
We are.
We've got our patient.
Mm-hmm.
What's our first clue?
All right, so clue number 1 is a detailed health history.
Okay, makes sense.
Yeah, so ask about recent illnesses, fever, cough, shortness of breath.
Okay.
Find out if they have any risk factors like smoking or a history of chronic conditions like COPD.
Hold on, wait a minute.
Yeah.
Can we define COPD for our listener?
Oh, of course, yeah. Not everyone might be familiar with that term.
Yeah.
So COPD stands for chronic obstructive pulmonary disease.
Okay.
And it's basically a group of lung diseases that make it hard to breathe.
Okay.
Emphysema and chronic bronchitis are the most common types.
Okay.
And COPD is often linked to smoking.
Okay.
But it can also be caused by long-term exposure to other irritants, like dust or fumes.
Got it. So if somebody has COPD, they're more likely to get pneumonia.
Exactly. It's a definite risk factor.
Okay.
So that's something to keep in mind during that health history.
Okay, so we've got medical history. We've asked about smoking.
Mm-hmm.
What else?
Well, it's also important to ask about any exposure to sick contacts. You know, have they been around anyone who's been ill?
Yeah.
Or have they traveled recently?
Okay.
Those details can give us some valuable clues.
Okay, so we've gathered all the background information.
All right, now what? Now it's time for the physical exam.
Okay, all right.
All right, so you start by inspecting the patient's chest.
Okay.
Just looking for any signs of respiratory distress.
Okay, what are some signs of respiratory distress?
Well, are they using those accessory muscles to breathe?
Those like neck muscles and stuff.
Exactly.
Yeah.
Is their breathing rapid or labored?
Okay.
Those are all signs that they're working hard to breathe.
And those notes, they mentioned cyanosis.
Ugh.
Yes, cyanosis. That bluish discoloration of the skin.
Right.
That indicates low oxygen levels.
Exactly. That's a big red flag.
Yeah, that's not good.
No, it's a sign that we need to intervene quickly.
Okay. So we're looking for cyanosis. We're looking for, signs of them struggling to breathe.
Mm-hmm.
What about their cough?
Oh, the cough. That's an important clue, too.
Okay.
So is it productive? Are they coughing up phlegm?
Okay.
Or is it dry?
Okay.
And if there is phlegm, what color is it?
Okay.
What's the consistency?
Yeah.
All those details can help us narrow down the potential causes.
Okay.
Yeah.
So we've inspected.
Right.
Right.
Now we move on to palpation.
Palpation.
Yeah. So we're feeling the chest
Okay.
to assess lung expansion.
Okay.
So is there reduced movement on one side that
Okay.
could suggest lung consolidation or fluid buildup?
Got it.
And then we have percussion.
Percussion.
Yeah.
Like a drum.
Kind of. We're tapping on the chest
Okay.
and listening for changes in sound. So a dull sound on percussion can indicate fluid or consolidation in the lungs.
Interesting.
Yeah.
So we've tapped.
We have.
What's next?
Now it's time for the stethoscope.
Okay.
We're going to listen to those lung sounds.
Auscultation.
Yes, auscultation.
Okay.
And there's the whole symphony of sounds we're listening for.
Okay.
Crackles, wheezes, raunchy.
Yeah.
Each one tells a different story.
Okay. So crackles, those are like.
Crackles often mean there's fluid in the alveoli, those tiny air sacs.
Okay.
So it's like a bubbling or crackling sound.
Yeah.
Wheezes are more of a high-pitched whistling sound.
Okay.
And that usually means there's some narrowing of the airways.
Okay.
And then raunchy are those deeper rumbling sounds that can
Ah.
indicate mucus in the larger airways.
Got it. So crackles, wheezes, raunchy.
Mm-hmm.
We're listening for all of those.
Absolutely.
Okay. And of course, vital signs.
Oh, yes, vital signs. Those are crucial.
So what are we looking at?
We need that temperature.
Okay.
Heart rate, respiratory rate, blood pressure, and oxygen saturation.
Okay. So we're looking for fever,
Yeah.
increased heart rate,
Yeah.
maybe rapid breathing.
Exactly. And oxygen saturation, that's a big one. We want that number to be above 90% ideally.
Okay.
And the notes also emphasize the importance of assessing mental status, especially in older adults.
Oh, yeah. Why is that?
Well, confusion or lethargy can be early signs of hypoxia,
Hypoxia.
which means the body isn't getting enough oxygen.
Oh, okay.
So it's a reminder that respiratory problems can really affect the whole body.
Yeah, absolutely.
Yeah.
Okay, so we've gathered all this information
Yeah.
from our history, our exam, our vital signs.
Right.
Now
we use all those clues to guide our next steps.
Okay, which are,
Diagnostic tests and treatment.
okay,
So for suspected pneumonia, a chest x-ray is usually the first step.
a chest x-ray.
Yep. It can show us if there's any lung consolidation or infiltrates.
And infiltrates, those are,
Basically areas of inflammation or infection in the lung tissue. So the x-ray shows us where the problem is, but we still need to figure out what's causing the pneumonia.
okay, how do we do that?
Well, a sputum culture can help with that.
A sputum culture.
Yeah, so we collect a sample of the patient's phlegm,
Okay.
and we analyze it to identify the specific culprit.
So is it bacteria? Is this a virus?
Exactly.
Let me-
And this helps us choose the most effective antibiotic if one is needed.
Okay, so we've got the chest x-ray, the sputum culture.
Mm-hmm.
What about blood tests?
Oh, yeah. Blood tests can give us some valuable information, too.
Like what?
Well, a complete blood count, or CBC, can show us if the white blood cell count is elevated, which often happens with infection.
Okay.
And then we have those ABGs,
Oh, yeah, the ABGs.
arterial blood gases.
We're going to get to those
We are.
a little bit.
Yes, but they can tell us about the oxygenation, carbon dioxide levels, and acid-base balance.
Okay.
So they're especially important in severe cases of pneumonia,
Yeah.
where the patient might be having a really hard time breathing
Yeah,
and their oxygen levels might be low.
got it.
So it sounds like managing pneumonia, it's a real team effort.
It does.
You've got the doctors, the nurses, the respiratory therapists, the lab technicians. Everyone's working together to help that patient recover.
And it all starts with that comprehensive respiratory assessment.
It does. That's the foundation.
Okay, so we've tackled pneumonia.
Mm-hmm.
Now let's shift gears a little bit and talk about pleural effusions.
Okay.
So remember, that's where fluid is building up in that space between the lungs and the chest wall.
Right.
And if that fluid's not supposed to be there,
Yeah,
it needs to come out.
it does.
And that's where those pleural drains and chest tubes come in.
Exactly. They're essential tools for managing these effusions.
Okay.
And choosing the right drain, like we said before, depends on the amount and type of fluid we need to remove.
Right.
So for simple effusions, those small bore drains or pigtail catheters, those are often sufficient.
Okay. But for larger volumes or air,
Right. Especially in trauma cases.
we need the big guns.
Exactly, the large bore chest tubes. And the nursing care for patients with these drains, it's really important.
What kind of care are we talking about?
Well, it's not just about inserting the drain.
Okay.
We need to make sure it's working correctly. We monitor the drainage. We make sure it's not getting clogged or obstructed.
Okay.
We manage the patient's pain because it can be quite painful.
Yeah.
And we do everything we can to prevent complications.
Okay, so we're monitoring their breathing.
Yeah.
We're listening to their lung sounds.
Exactly. We're also keeping a close eye on the drainage.
Okay.
You know, how much is coming out? What color is it? Is there any blood?
Yeah.
And we're documenting everything carefully.
Okay.
It's a lot to keep track of.
It is, but it's all important.
It is.
Right.
Every detail matters when it comes to patient safety.
Absolutely.
Yeah.
So we've talked about the drains themselves,
Mm-hmm.
but then there's patient education.
Oh, yeah. That's a crucial part of it, too.
Yeah, you have to explain to the patient what that drain is for,
Right.
how it works,
Right.
and what they can do to help their lungs heal.
Exactly. So we encourage them to take those deep breaths, to cough,
Okay.
and to use an incentive spirometer if they have one.
Okay. And what's an incentive spirometer?
Oh, it's this little device that helps them expand their lungs.
Okay.
So it's like a visual reminder to take those deep breaths.
Got it.
And those nursing notes, they went into a lot of detail about dressing changes.
Oh, yeah, for the drain site.
Exactly. There's a very specific technique to prevent infection.
Okay. What is it?
Well, it all starts with hand hygiene,
Of course.
right? We got to keep those hands clean.
Yeah.
We put on our personal protective equipment, you know, our gloves, gown, mask. We cleanse the insertion site with that antiseptic solution, and then we apply a fresh, sterile dressing.
So it's all about maintaining that sterile field.
Absolutely.
Okay.
We don't want to introduce any new problems while we're trying to fix the old one.
Makes sense. And of course, we document everything.
Oh, yeah. Always documenting every assessment, every intervention, the patient's response to treatment.
Okay.
It's so important for communication among the healthcare team.
Yeah.
And it ensures continuity of care.
Okay, so we've talked about the nursing skills for pneumonia and pleural effusions.
Mm-hmm.
What about tuberculosis?
Ah, yes, TB.
Are there any special considerations there?
Well, with TB, infection control is really the top priority.
Okay.
Remember, it spreads through the air,
Right.
so we have to be extra careful
Yeah.
to prevent those bacteria from spreading to others.
So what kind of precautions do we take?
Okay, so first of all, we use airborne isolation precautions.
Airborne isolation.
Yeah.
What does that mean?
So that means the patient is placed in a negative pressure room,
Okay.
and healthcare workers have to wear those special N95 respirator masks.
Every time they enter the room?
Exactly. It's all about protecting ourselves and other patients.
Okay. And what about the patient themselves?
Well, we also need to educate the patient and their family
Yeah.
about ways to prevent the spread of TB.
Like what?
So things like covering their mouth and nose when they cough or sneeze, and disposing of tissues properly.
Okay.
Simple things, but they can make a big difference.
Absolutely.
Yeah.
And it makes you realize how important it is
Mm-hmm.
to follow all those public health guidelines.
It is
It's not just about you.
right. It's about protecting everyone around you.
Exactly.
And you know, it's also important to remember the emotional impact of a TB diagnosis.
Oh, yeah.
It can be really scary and isolating.
Yeah.
Especially because there's still some stigma associated with the disease.
Yeah, absolutely.
So a supportive and compassionate approach is really crucial.
Yeah, I can imagine.
Yeah.
So we've talked about these specific nursing skills for, these specific conditions.
Mm-hmm.
Are there any broader concepts that apply to all respiratory conditions?
Oh, definitely. So let's think about oxygen therapy, for example.
Okay.
It's a fundamental intervention for patients who are having trouble breathing or maintaining those oxygen levels.
Right.
And there are different methods of delivering oxygen, from those nasal cannulas to face masks to even mechanical ventilation in more severe cases.
Okay.
And nurses play a key role in all of this.
How so?
Well, we assess the patient's need for oxygen,
Okay.
we administer it safely, and we monitor its effectiveness.
So,
And then another essential concept is airway management.
Airway management.
Yeah, so this involves keeping those airways clear
Okay.
of secretions and obstructions,
Right.
which can be really challenging in patients with pneumonia or other lung infections.
Yeah.
Those airways can get pretty congested.
Yeah. I remember learning about different suctioning techniques.
Oh, yeah.
And postural drainage and chest physiotherapy.
Right. All those techniques can help loosen and remove that mucus from the airways.
Okay. And sometimes you need more invasive airway management.
Sometimes, yeah, like intubation and mechanical ventilation.
Right.
Those are pretty complex procedures.
Okay.
They require specialized training.
So it's a lot more than just, giving medications.
It is.
Taking vital signs.
Exactly.
It's really incredible how much knowledge and skill goes into caring for these patients.
It's a demanding field, but it's incredibly rewarding.
It sounds like it.
Yeah. And as we've seen, it's so much more than just the technical aspects,
Yeah.
It's about understanding how the body works. It's about critical thinking. It's about providing that compassionate care to patients who are often feeling very vulnerable.
That's really well said.
Thank you.
Okay, so we've covered a lot of nursing skills
We have.
related to all these different respiratory conditions, but there's still one piece of the puzzle that we need to revisit.
Oh, yeah, you're talking about.
The ABGs.
Ah, yes, those arterial blood gases.
They're like a window into the body's acid-base balance.
They give us so much valuable information.
And it's crucial for maintaining that balance.
It is. If that balance gets thrown off, things can go south pretty quickly.
Yeah, okay, so ABGs, they can feel a little bit like a secret code,
They can.
but once you crack the code, they reveal so much.
They do.
So let's dive back into that world
Let's do it.
in the next part of our deep dive. All right, we are back for the final part
We made it.
of our respiratory deep dive.
Yeah. It's been quite a journey, hasn't it?
It has. We went from those common infections, pneumonia,
Right.
tuberculosis,
The silent threat.
to those more complex things like pleural effusions.
Yeah.
And we talked about the nursing skills
Absolutely.
needed to care for those
It's
patients.
a lot to know.
It is. But we are ready to tackle those ABGs.
Right. Let's do it.
Arterial blood gases.
Yeah.
You said they're like a window
But
to the bodies.
basins.
Okay, I'm ready to decode.
Okay. Let's do it. So ABGs, they might seem a little mysterious at first,
They do?
but once you understand the basics,
Yeah.
they can tell you so much about what's going on inside a patient's body.
Okay.
Remember, our bodies are constantly producing acids as a byproduct of metabolism,
Okay.
and it's the respiratory and renal systems that work together to keep those acids in check.
So it's like a delicate balancing act
It is. It's all about maintaining that balance.
to keep our blood pH
Right.
in a very narrow range.
Exactly. And that's where EBGs come in.
Okay.
They help us see if that balancing act is working as it should.
Okay, I'm listening.
Okay, so let's break down the components of an ABG.
Okay.
So first up, we have the pH,
pH.
which is a measure of acidity or alkalinity.
Okay, remember that from chemistry class.
Yeah, so a pH of 7 is neutral, anything below 7 is acidic, and anything above 7 is alkaline or basic.
Okay, but normal blood pH isn't 7.
You got it. It's actually slightly alkaline,
Okay.
falling between 7.35 and 7.45.
So our bodies like to be a little bit
A little bit alkaline.
alkaline.
Exactly.
Okay, so that's pH.
That's pH.
What's next?
All right, next up we have the PaSO2,
PaxO2.
which stands for the partial pressure of carbon dioxide.
Okay.
This tells us how much CO2 is dissolved in the blood.
Okay.
And remember, CO2, it's an acidic waste product
Right.
that's removed from the body by the lungs.
Okay, so high PaCO2 means...
PaSO2 means there's too much CO2 in the blood, which makes the blood more acidic.
Okay, and low PaCO2 means...
Low PaSO2 means there's not enough CO2, making the blood more alkaline.
Okay, so we've got pH, we've got PaCO2. What else is there?
Okay, the last piece of the puzzle is HCO3,
HCO3.
which stands for bicarbonate.
Bicarbonate.
Yeah, and bicarbonate acts as a base.
Okay.
So it helps neutralize those acids in the blood.
Okay.
And it's the kidneys that regulate bicarbonate levels.
Okay, so high HCO3.
High HCO3 means more base, and low HCO3 means less base,
Got it.
which could tip the scales towards acidity.
Okay, so we've got these three values, the pH, PaCO2, and HCO3.
Yeah.
How do we actually use those?
How do we put all those pieces together?
Yeah, to like make sense of an ABG.
Well, it's like solving a puzzle.
Okay.
You got to look at all the pieces and see how they fit together.
All right, so we've got the puzzle pieces.
Yep.
And we've got those 4 acid-base imbalances.
Right.
Respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis.
Right. So each imbalance has a specific pattern
Okay, you got
on
it.
the ABG.
You got it.
Okay, so let's break it down.
Okay, let's start with respiratory acidosis.
Respiratory acidosis.
So this happens when the lungs can't remove enough CO2
Okay.
from the body.
So the CO2 builds up.
It does, and that leads to an increase in PaSO2 and a decrease in pH.
So the blood becomes more acidic.
Exactly.
Okay, so what kinds of things can cause respiratory acidosis?
Well, anything that impairs lung function,
Right.
really.
Yeah.
So COPD, pneumonia, even a drug overdose that suppresses breathing.
Wow, so it's a breathing problem.
It is. The lungs aren't doing their job of getting rid of that CO2.
Okay, so that's respiratory acidosis. Now, what about respiratory alkalosis?
Right, so respiratory alkalosis, it's kind of the opposite.
Okay.
The lungs are removing too much CO2.
Okay.
So that leads to a decrease in PaSO2 and an increase in pH.
So the blood becomes more alkaline.
Right.
Okay, so what would cause that? Well, think about things like hyperventilation,
Okay.
which can be triggered by anxiety, pain, fever.
Okay, so the lungs are like overworking.
Exactly. They're getting rid of too much CO2.
Got it.
Okay, now let's move on to the metabolic imbalances.
Okay. Metabolic acidosis.
So metabolic acidosis occurs when there's an excess of acid in the blood
Okay.
or a loss of bicarbonate.
So the problem here isn't the lungs.
Right, it's not a breathing problem.
Yeah, it's like a metabolic problem.
Exactly. It's
That's
the
it.
body either producing too much acid or not getting rid of it efficiently.
Okay, so what kind of things can cause that?
Well, think about conditions like diabetic ketoacidosis,
Okay.
kidney failure, or severe diarrhea.
Okay.
All of those can lead to metabolic acidosis.
Okay, and then we've got metabolic alkalosis.
Right, so metabolic alkalosis is the opposite.
Okay.
There's an excess of bicarbonate in the blood
Okay.
or a loss of acid.
Okay.
So things like excessive vomiting, overuse of diuretics, or even certain hormonal disorders can cause this.
Okay, so it's like the body's chemistry is off.
Exactly, that delicate balance is disrupted.
Got it.
Okay, so we've got our four main imbalances.
Right.
Respiratory versus metabolic.
But you said the body tries to compensate.
It does. The body is amazing, like that it's always striving to maintain that pH balance.
So if the lungs are the problem,
Mm-hmm.
the kidneys try to help out.
Exactly, and vice versa.
Okay.
So if the primary issue is metabolic, the lungs will try to compensate.
And we can see this compensation
Literally.
in the ABG results.
Yes. So, for example, if someone has respiratory acidosis, their kidneys might try to compensate by retaining more bicarbonate,
Right.
which would show up as an elevated H2O3 level on the ABG.
Okay, and what about metabolic acidosis?
Well, in that case, the lungs might try to compensate by increasing the respiratory rate.
Okay, to blow off more CO2.
Exactly. And that would show up as a lower peptide level on the ABG.
Okay, so the degree of compensation tells us how well the body's coping.
It does. It's like a little sneak peek into how hard the body is working to maintain that balance.
So if the pH is still out of whack, even with the compensation,
We call that partially compensated.
partially compensated.
Yeah.
But if the pH is normal,
Mm-hmm.
even though the other values are off,
Then it's fully compensated.
then only compensated.
Which means the body is winning the battle for now.
But the underlying problem is still there.
Exactly. It's like putting a Band-Aid on a bullet wound.
Okay.
You stop the bleeding, but you still need to address the real issue.
Yeah.
So interpreting ABGs, it's like solving a puzzle. You look at all the pieces, the pH, the picoto to the HCO3, and you consider if there's compensation happening.
It's a skill
It is?
that takes practice.
It does, but it's so important for nurses.
Yeah, especially those working with respiratory patients.
Absolutely.
And you know what I'm realizing is that the respiratory system,
Yeah.
it doesn't exist in isolation.
It doesn't, it's all connected.
Yeah, like what happens in one system
Right.
impacts all the others.
Exactly.
It's like a domino effect.
It is, the body is this amazing interconnected network.
And we've seen that firsthand
We have.
in this deep dive.
We've explored the intricacies of the respiratory system.
Yeah.
From those common infections to those really complex physiological processes.
Yeah,
And we've seen how important nursing knowledge and skills are in caring for these patients.
absolutely.
It's a challenging field.
It is, but it's so rewarding.
It really is. It's amazing to see how something as simple as breathing is actually orchestrated by such a complex and fascinating system.
It is, and it really highlights the importance of taking care of our respiratory health.
Well said. I think we've successfully navigated the world of the respiratory system in this deep dive.
I think we have.
But as always,
There's always more to learn,
there is.
so keep exploring.
Yes, and until next time, keep breathing and keep learning.